Hello, I'm Dr. Frank Nichols, a general thoracic surgeon and also the medical director of the revenue cycle. I'm here today to talk with you about recent changes that have taken place with regards to teaching physicians and their ability to use greater amounts of medical student documentation. What I'm talking to you about is only applicable to the use of medical student documentation. Unfortunately, at this time, the documentation by our NP and PA students cannot be used in the same way. Additionally, nurse practitioners and physician assistants cannot use medical student documentation in the manner discussed in this presentation. We recently received confirmation from the Centers for Medicare and Medicaid Services, CMS, that these new changes apply only to medical student documentation. Nationally, we know this is upsetting to a number of non-physician groups, and we are hopeful CMS will reconsider its position in the future. With the change in the use of student documentation, students have been given increasing responsibility with regards to evaluation and management documentation within the medical record. Teaching physicians benefit from now having the option to use medical student documentation without the need to extensively redocument themselves. However, verification of the student documentation is necessary and certain other conditions apply. Specifically, CMS requires that certain portions of the E&M service be performed or reperformed by the teaching physician. Here for your reference is the new guidelines from the Medicare Claims Processing Manual. The changes applicable to the use of student documentation are shown in red. Students may document services within the medical record. However, the teaching physician must verify in the medical record all student documentation or findings, including the history of present illness, physical examination, and medical decision-making. The teaching physician must personally perform a physical examination and actively participate in the medical decision-making portions of the E&M service being billed. Importantly, if they wish, the teaching consultant may use the medical student's documentation without the need to redocument. However, they must, through attestation, verify any student documentation used. Teaching residents may also use or reference the medical student's documentation, but the teaching resident is required to do an independent note. So who at Mayo Clinic is a teaching physician? It's an MD or DO consultant, a resident or fellow. With regard to the E&M components, what this means to the teaching physician is as follows. For the history of present illness, the teaching physician may use student documentation if they were physically present when that information was gathered by the student. If the teaching physician was not present, then the teaching physician needs to reperform the history of present illness. However, in either case, the teaching physician may use the student's documentation. Teaching physicians must verify the student documentation. With regard to the review of systems, past medical, family, and social history, the teaching physician does not need to be present for or reperform these components. The teaching physician may use the student's documentation for these components as long as the teaching physician verifies the student's documentation. As for the physical exam, the teaching physician must perform pertinent components of the physical exam that they feel relevant. The teaching physician may use the student's documentation for the physical exam, but ideally identify the portions of the physical exam they performed. As for medical decision-making, the teaching physician must perform medical decision-making. Practically speaking, I take that to mean actively participate with the student in the medical decision-making process. Again, teaching physicians may use students' documentation. Importantly, if the teaching physician uses the student's documentation for medical decision-making, the teaching physician must assure its accuracy and clearly state agreement with the student's documentation of the medical decision-making. Attestation and verification by the teaching physician is required for the use of student documentation. I'll share with you shortly recommended attestation language. It is really important that diagnoses related to a particular E&M be verified and attested to by the teaching physician, as these diagnoses will be associated with coding, which impacts quality reporting and yes billing. The teaching physician must personally perform to the level of service that is eventually billed. Put another way, for billing purposes, the teaching physician's E&M code must stand alone and be reflective of the work they individually performed. Time-based billing of E&M codes is allowed, but must reflect the work performed by the teaching physician only. Specifically, Combined time-based billing of E&M codes, that is, combining a student's time with the teaching physician's time, is not allowed. In the next two slides, you'll see examples using student documentation. In scenario 1, which occurs in the clinic setting, the medical student performs the history of present illness and physical exam on the patient in the physical presence of the teaching physician. The teaching physician appropriately reperforms key elements of the physical exam that they feel appropriate, and the teaching physician actively participates in the medical decision-making process with the student. The teaching physician then uses the student's documentation. The teaching physician must attest to and verify the student's documentation. This service is ultimately billable under the teaching physician's NPI number. The next scenario involves medical student, resident, and teaching consultant, a common finding in the hospital setting. The student sees the patient, performs a history of present illness and physical exam on the patient without the resident being present. The teaching resident then reperforms the history of present illness, physical exam, and medical decision-making. The resident can use the student's documentation. The resident, however, must verify the student's documentation through attestation, but that attestation must occur in the resident's own independent note. Mayo policy requires that the resident perform their own independent note. The teaching consultant may then, through an attestation statement, use the resident's documentation as they normally would, as long as key and critical elements as determined by the teaching consultant are also performed by that consultant. Key elements for E&M services do include a physical exam and medical decision-making. Here is an example of a teaching physician's attestation language. I saw the patient with, and put in the student's name, medical student. I was present for or reperformed the history of present illness. I performed a physical exam and did medical decision-making. I reviewed the documentation of, and put in the date, and agree with or amended. Here is a table showing the common scenarios that we discussed in the previous slides. I will not spend a lot of time going through the table, but let you review this on your own. Again, if medical students' documentation is used, verification and attestation by the teaching physician is required. There are some unique nuances to EPIC. Within EPIC, each provider has separate documentation. Student notes require a consultant co-signature. Student notes will associate with the teaching physician's note if the date of service, service type, and note type occur on the same or next day. If the teaching physician uses student documentation for components of required billing elements, specifically the history of present illness, physical exam, and medical decision-making, then the student note requires attestation with agreement or amendment, as we previously discussed. In summary, some key points to reimbursement and compliance with regards to the use of student documentation are seen here. I will let you review on your own these bulleted items. Again, some additional keys to reimbursement and compliance are seen here. These were all covered in the previous slides. Some highlights, though, are bullet 2, where it is critical that accurate diagnoses be listed and evident to coders. And also bullet 4, where the teaching physician must personally perform at the level of service billed or be face-to-face with the patient for the time utilized in determining the level of service. Again, combined time-based billing of E&M codes is not allowed between teaching physician and students. I would like to thank you for your time. I am hopeful that you have found this useful. Should there be questions regarding this presentation, please feel free to reach out to me directly. Other contacts include Amanda Attaway of our Medicare Strategy Unit and Judy Dockin of the Revenue Cycle Coding Operations. Our contact information is on this slide. Thank you for your attention, and I hope you have a good day.